salsa mode, and now we're going to be trying out the newest at-home devices for back relief. They are perfect for when you want an expensive massage, but you just can't afford one. So I wanted to actually bring a medical professional on. So I've got a physical therapist, Karena Wu here. Come on in, Karena. So everyone just heard the word trigger point used quite a bit in conjunction with these things. I don't know if you use these in particular, but what are trigger points? And since you're an expert on it, walk us through what might work for them.
Trigger points are hyper-irritable, hypersensitive areas in muscle and connective tissue, and they're often associated with palpable taut bands or nodules, or what are commonly referred to as knots. They cause pain both locally and in distant areas, and they can also cause pain at rest. So what's great about these is the fact that these massagers can help release those tight bands and help reduce your perception of pain.
Just by putting pressure on them?
Yes.
And do you recommend them to your clients?
Absolutely. Absolutely.
Oh, my goodness. All right, they're not too expensive either, which is what I liked about it.
Yes.
All right, so I'm going to move to a different kind of pressure point, though, because my audience, they all have trigger point balls. Notice them over there. Look, there they are, working them all, working them.
I'm massaging my back.
Does it work?
Yes. Loosening my muscles.
Feels
good
very
posture.
different.
Different in a good or bad way?
In a good way, hard.
Here, how about for 1 second? I'm going to try that out. I never thought of that idea. So you can actually do this. Here, don't leave. So don't go far here. How are you?
Good, how are you?
So you put it back there. Like this?
Oh. Wait, no. You gotta put it there and then roll it up and down your back. Feel it?
I like that.
Yeah, it feels good.
So who's this right for?
This is great for anyone who's got pain or tenderness in their soft tissues. They do require a little skill and coordination, but these are great, especially the balls, which come in a smooth and a spiky or nubbly form. They're small, they're lightweight, and they travel really well.
Yeah.
Thank you. Let me borrow your seat. You know, I like when you can use your own body weight to make these things happen, because it's sort of like you're not doing it yourself, which I was getting to earlier. So it's nice to have some human connection. But these things are a little spiky. Is this... I mean, again, this is one way of doing it, but you have another really low-cost approach to getting us to where we need to be, which is prolonged stretching.
Yes. To address fascial tissue, you are going to do a prolonged stretch. So your stretch needs to be held a minimum of 90 to 120 seconds, and it needs to be more gentle, because a lot of people really pull hard during a stretch, and if their muscle is tight and tender, that tissue is going to fight you. So
90 seconds.
90 seconds minimum for a prolonged, gentle stretch.
All right, guys, thank you for joining us.
Thanks
Love your
for
advice.
having
Keep
us.
it up.
Thank you.
We'll be right back.